Again, welcome everyone to the Shelter Severity Classification training. This is the part one of the training, which will be done in three phases. First, webinar one is today. Second is webinar two next week on the same time, same day on Tuesday. And the last part will be during the coordination workshop that will happen in Geneva on the 19th and 20th of June this month. So probably mostly we will have these 3 weeks. Every week we will have kind of a catch up on the shelter severity classification. What we're going to cover in this training is for today to have a quick introduction on the background, the rationale and of the SSC, some theoretical background, and this part mostly being covered in the launch webinar that happened in May. The recording of that session and the presentations are already on the website. You can access them and the resources, shelter severity classification, and we will post the link in the chat soon. Then we will go on the technical details of the calculation methodology, how we will estimate the pain and severity through all steps, starting from information identification up to the final step on the pain and severity figures. Next week, we will see how we can utilize this information that we'll generate through the analysis and what outputs that we can generate. So we will have the shelter needs overview. We will see how we can use the online dashboards that we are creating and the linkages between the shelter severity classification and the GF. And during the coordination workshop, for colleagues who will be joining us here in Geneva, we will be doing a full simulation on how to implement the SSC. Maybe next slide, Camila. Just a quick disclaimer here. We are using in this training some dummy data that was randomly generated. It doesn't relate to any of the situations or any actual analysis, but it is built on the standard MSNA questionnaire that is part of the SSC. But for that, we are using the maps of Somalia, but there's nothing to do with the shelter situation in Somalia. Just we want to make this disclaimer at the beginning, so not to quote any of these slides or snapshots that you will see here as facts on the Somalia situation. For now, I will give the floor to Neil to get us through the background on the objective of the SSC.
Thanks, Hussein. Can you hear me okay? Want to make sure my mic is working. Yep, good. Well, good to see a lot of friendly names on the chat list. Good to have this type of audience. For what Hussein was just saying, we have done a webinar before on a bit more of the background and the theory and the rationale for why this tool is being rolled out now. I'll try and summarize some of that now, but this tool and the rollout here is the consolidation of, I would say, a lot of thinking over the last even 8 to 10 years on how the sector can begin to standardize or at least systematize the way that we define what shelter needs are and how potentially they can be addressed. This SSC, the shelter classification, shelter severity classification, is, in our view, a starting point. It's the initial seed for how the sector can begin to define what needs are, how it gets categorized, and how it can be turned into the tools that we use on an intersectoral level to provide a strategy for how we implement. What this tool has, you'll see from this slide, there are basically 3 things that it's trying to do. One, and probably the most evident from it, is that it will provide us a logical and I guess evidence-based set of tools for defining the quantity, the number of people in need of shelters, the PIN, which you've probably heard a lot about in recent years, the PIN for shelter, and a level of severity of those needs. And this is, again, and you'll see it's based upon a graded index from 1 to 5, 1 being, low needs to 5 being high needs. The second thing that it's doing is it's also providing you a tool to make sure that you understand what the context variables are. What are the conditions around shelter and around intersectoral issues that will influence that analysis. And then the third is to get an idea of what all of the contributors are. What are other factors that may influence the future direction of the response. Also, some of the background indicators and metrics and qualitative information that needs to be considered as part of the overall analysis to drive what the implementation strategy might look like. Can you move to the next slide? So just to give you a sense of what we see this tool delivering on, we're going to jump now to the endpoint. What is the output from this going to look like? The first thing is it will give you the evidence and the rationale for providing your shelter needs overview, the SNO as we call it. This provides you the data that the shelter needs overview can deliver, and that is generally in a report format. And this is an example of what the content of that HNO might look like. Next slide. And as I was saying, this is a
colleagues there. Sorry to interrupt, Neil. There's colleagues unmuted. Please mute yourself if you're not speaking. So I think, Neil, you will be only the one speaking now. Please, colleagues, mute yourself. Thank you.
Okay. Thanks, Hussein. As I was mentioning, so this is a very data-driven exercise. You'll see how this gets built, but the tools will help deliver a structured set of data that will categorize the information, that will classify and aggregate that information into the categories that we're talking about, and will highlight certain areas that may be of more interest than others, areas that might have high levels of need and high numbers of people in need. Again, categorized by certain. And then third is it will help to generate geographic information that will help us to identify which areas are there geographic trends on where needs are high and severity is also high. So this is just an example of what we see the outputs looking like. And for the duration of this and the future seminars, we're going to show you how to get there. I think that's kind of it from my side. Is if there's any questions on the why we're doing this and what we expect to deliver from this, now would be a good time to raise any sort of those fundamental questions. I don't hear anything. Oh, we got a raised hand. Go ahead, Hashim.
Yeah. Yeah, thank you so much. I'm not sure if I'm too early to ask these questions, but I was thinking if we could know what would be the factor behind this shelter severity classification. I think it depends on the situation in each context. Sorry if I'm not relevant.
Yeah, it's an exceptional point, and I probably should have raised this. So I think if I interpret your question right, is that every context is different, and every context has its own set of variables, correct? And And so this is a fundamental part of this tool is the adaptability and the flexibility for it to be adaptive to each context, for each country to be able to choose their own metrics that will describe their context. Hopefully I answered that question. There's another hand that was raised. I got a thumbs up. Another, okay. Any other questions? They'd be most welcome, but oh, we got a hands up. Who's that? John.
Yes, John, please come in.
Good afternoon, everyone. Nice to see you
Hi,
all
John.
online. Just
Yeah.
this is excellent initiative. Thank you. Just to clarify, the difference between this and a country that does a HNO. So when we do a HNO with a full GIF in country, is there a need to also do a shelter severity framework, or does the HNO suffice? Is it the same? Back to you.
We will come to exactly that point, but yes, this is a small piece of a much bigger system. I mentioned that we've been working on this SSE, at least the concepts behind it for about 8 to 10 years. The catalyst for putting this all together is the GF, and the role that the SSE plays within the GF will show that. And yes, you're right. The HNO will be the fundamental driver from it in context where where that's the expected deliverable, but the shelter component is a part of that. So we'll come to that. Thanks, John.
Yep. Thanks, colleagues. Thank you, Neil, for this introduction on the SSC. Now we will move to look at the methodological components of this framework and how it's kind of plugged in together, to generate this whole framework. Next slide, please, Camila. So if this is a general overview on the framework and how it's structured. As you see, we have 3 different colors here. The blue part, which refers to the crisis itself, the context, the scope of analysis, where we base our analysis, background, our underlying vulnerabilities and capacities at both household and community levels, as well as other humanitarian conditions, other sectoral conditions that are affecting the shelter situation. This is whole underlying analysis that will be conducted, and then on top of it, we have the shelter needs and conditions in the reddish part, where we thought about this in 3 pillars. First of all, the shelter itself. Second, inside the shelter, how people are practicing their domestic life, and we translate it into living conditions. And the third pillar is outside the shelter, where it links to the settlement and the settlement approach. And on the top, you see the impact of shelter conditions. So here we see how these needs and these shelter needs are contributing to other sectoral needs as a full circle of impact, and what would be the potential impact of the unmet shelter needs in the long term. Next slide, please. The severity phases for shelter, we have adopted the same scale like that is used in the humanitarian context of 5 severity scales from minimal up to catastrophic. And we have definitions at the household level and at the area level. I will not go in details of these definitions here, more or less. They've been covered in the launch webinar, and you can refer to those recordings. And as well, you can refer to the guidelines where we have more details around these phases. Next slide, please. So yeah, here we see the area level severities, and we adopt the 20% rule to generate the area level severity. So 20% of the household living under that severity phase, and wherever we cut that threshold, we will consider the area level severity. But this is the preliminary severity that will be adjusted in the end, and as we will see later in the demos. So the concept of the three pillars, as you have explained a little bit earlier, so we depend on the people have a dwelling, and we use this simple language of the population or the people, and how they understand or they describe their need, if they have a home, if they can practice their life in their home, and if they can have access to services around their home. And if you look at these three boxes under each pillar, how we translate each one into our technical language from shelter cluster perspective. So people have a dwelling means we are focusing on the shelter as a structure, and then people can live properly on the living conditions. And then on the third pillar, if they have access to common service and infrastructure around them, it's more towards the settlement approach. In total, the if you go back, Camila, please. Sorry. Yeah, the overall things that we are looking out of this framework is that people or households can live with dignity and security of tenure in adequate dwellings with access to community level services and infrastructure. So this is the guiding principle behind this design that we are building here. Next, please. For this design to be measured and to be able to really quantify and do the analysis, we have identified for each pillar a major indicator with sub-indicators that will be guiding us through any data collection exercise and any analysis that we will put forward. The list of indicators will be covered later in this presentation during the demo as well. Next slide, please. So the calculation model depends on these indicators and allow us to measure the pain and the severity. So we start with the assessment or the indicators. We phrase our questions and how we measure them based on the context. So each context or each country cluster will be able to define their own questionnaire, but in the end, they will use what we call the analysis grid to translate those questions into the same indicators that we have defined. And from there, we will guide the analysis through the decision tree approach, which we have on the three pillars, each severity score, how we will consolidate these three pillars together into a final severity score. And from there, we will generate the PIN and the final severity score. Next slide, please. Just to summarize here a little bit, the SSC is a framework that is contextualizable. Like it provides set of indicators that we introduce at a global level, but you can redefine these indicators and redefine the questions that are linked to those indicators in any data collection exercise that you will use according to your context. And on top of that, we have the analytical methodology that will guide from that questionnaire or that assessment into the final output. It will allow us to describe the vulnerabilities within the context that we are working in, and mobilize our resources towards areas with high severity and high PIN. What is not in the SSC today is not a household selection framework. So we don't use it to target households. We don't use it for the final operational planning. It just gives us where we can mobilize resources at the area level. And it's not a tool to compare a crisis against another crisis. So it's not a tool to compare Ukraine versus Yemen or Yemen versus Colombia, for instance. It's not a tool to be used at all towards that. And here we re-emphasize on the contextualizable element of this framework, that every country will adapt this framework and projected to their context, and from there they will do their own analysis, but under the same concept of the three pillars. Now Camila will guide us through the implementation and how we define the standard questionnaire and through the steps out to until the end, where we generate the severities and the population figures. Over to you, Camila.
Thank you, and hello everyone. Can you hear me fine? Yep. Okay, good. Okay, so first, I'm going to give you the overall implementation cycle of the SSC. It's a standard analysis, assessment, and analysis cycle, but just to be all on the same page. So the very first step is where you determine your information needs. So that's when you work with, you develop questionnaires, you identify what type of information you need to conduct your HNO in cases where there is an HNO, and so on and so forth. Then you have the data collection exercise. We'll get back to that because it's, of course, very important for cluster coordination teams to be involved in these data collections. Then you have the whole SSC analysis, and that's where we'll spend most of today's session to present what that looks like. And then finally, the development of outputs, the shelter needs overview, and how to use it. So in cases where you're rolling out the SSC in a HNO context, this is an indicative timeline that you will have. And I would imagine that most of you that are currently in a HPC cycle are in the process of designing questionnaires, working to start data collection, and so on. But essentially, between beginning of the year and the month of May, that's when you determine your information needs. Then over the summer, collect data, do the analysis, and then publish. So to go back to the question that was raised before about the link between the SSC and the HNO, the idea is that the SSC becomes your shelter analysis for the HNO. So you're not going to be calculating two different pins or two different severities, but the SSC is a methodology to do the shelter section of the HNO. We'll go back to that. So what does information needs refer to? So usually information refers to what you will need to calculate your PIN and so on. As much as possible, we try to encourage household level primary data collections. Thankfully, in most HPC contexts, there is a MSNA that is being conducted, but then we also know that there are some areas that may not be accessible. But determining your information needs, even if you're using the same questionnaires that you may have used before, is very important because you don't want to be missing out on what you would need to do your analysis. But that's not the only source of data, the primary data collection. We also encourage through the SSC model to use, for all the different parts of the framework, to use secondary data to inform your analysis. In the context where there is a GF being conducted, we'll get back to that as well, but very briefly, the GF process does include a section where all clusters come together and they do an analysis of the context, of vulnerabilities, and so on. Use this. Don't reinvent the wheel. Refer to it. Make sure that you're connecting to intersector analysis. And then finally, all of this information and data should be, to be sure that you're tracking it and that you're keeping keeping track of how you're going to use it. We've designed a template called the evidence list, and I will show you this a bit later on. Hussein, do you want to give us a brief overview of how GF fits with?
Yeah, sure. So again on the GF and how SSC is linked to GF. As you see in this slide, it's the overall structure of the GF 2.0 that will be rolled out this year, and it's coming to the countries. I mean, you will see more emails coming towards the countries on that in the coming days. So it has the as you see on the top block, it's the contributing factors and the scope. As you see, the context, shocks, impact at the system level, at the population level, and so on. So all of this is happening at the GF level in the beginning of the GF process, where we identify all of these elements in the beginning and probably in accordance to the timelines that we have set up for the SSC. So whenever this and with active participation with the GF analysis team, you will be able to get all of those information sources and utilize them, project them with shelter lenses and see how you can benefit from them for your own context. And in the second block on the bottom left, you see shelter as in the small red rectangle. Here where it comes the SSC, the implementation of the SSC. And in the GF, they require to share the PIN and the severity score, the final PIN and the final severity score per the agreed upon admin level, the unit of analysis, and plus the methodology that you have followed. Here now we have a standard methodology, which is called the SSC, that will be trying to roll out all over the countries, and then the input will be used in the final GF analysis at the intersectoral level. This whole process of GF will feed into the HNO at the OCHA level, and from our side, from shelter cluster, we will use our own analysis by implementing the SSC to generate the shelter needs overview that can be summarized to the HNO chapter, can be used in for other different purposes. So this is simply how and where the SSC sits inside this whole HPC cycle. Back to you, Camila. We lost you, Camila, I think, or you're back. Okay, you're back. No, maybe you can join me here on my laptop.
Can you? Okay.
Sorry for this technical issue.
Perfect. Are we sharing your screen or?
Share my screen.
It's working? Okay, shall I go back? What can you see?
My screen now. Reshare your screen, please.
My laptop is frozen now.
Sorry, colleagues, we are facing some technical issue here.
Yeah, probably. Can you to restart my laptop.
Okay, colleagues, I hope you can see me well and you see my screen now.
Yes.
Okay, good. Camilla, would you like to continue the presentation from my computer here, please? Yeah. Yeah, please.
Hello, sorry about that. Okay, so to go back on data collection, so we'll discuss how to design the questionnaire in the next section of the training. But what's really important is that from the beginning you are involved in the design of the questionnaire, usually the MSNA that is being conducted. In addition to the design of the questionnaire itself, we really recommend that you be involved in the training of enumerators when those trainings happen, because the shelter especially the shelter section is quite technical, and you want to make sure that the enumerators are well aware of, are understanding the terms in the way in which they were intended. So if you can, participate in the training of the enumerators. It's also really important that you have a look at the pilot data and provide feedback as needed to the enumerator teams to make sure that the data that is being collected is as good as it can be. This is really important because you want to make sure that this is your opportunity to make sure that you're collecting the data you need to roll out the SSC. Sorry. Okay, we're done with the overall implementation. Do you have any questions? Otherwise, we can move on to the demo. Yes, Ali.
Thank you, Camila. I'm not sure if this question is suitable for now, but in contexts where the MSNA is not available, like in Yemen, we don't have the MSNA. We have different other sources of data. So does it applicable, or this SSC can only apply it for one data source? Over to you.
So this is a very good question, and thanks a lot for asking it. So for now, it is true that we've designed the tool to be applicable from household level data onwards. However, it is also applicable to cases where you don't have household level data. It's the same approach, the same framework, the same concept of the 3 pillars, the 5 phases, but there will be a difference in how you then use the tool itself to estimate your PIN and the severity. So yeah, thanks a lot for asking that, because we're aware that although in most cases there is an MSNA, there are cases where there isn't. Any other question? Otherwise, move on to the demo. There is. Sorry, I can't see that. How does the SSC apply to sudden onset non-GF? Yeah.
I can take this, Camila.
Okay.
So in sudden onset or non-GF or whatever, the thing that usually happens in the countries, let's forget about the SSC, let's forget about any framework. As a coordinator, what would you do in a sudden onset? How would you estimate the severity and the PIN number? Usually, I mean, I see so many coordinators on this call, but I would suggest that from our experience that a secondary data analysis will happen, and that corresponds to the blue part of the framework, as we said before. And then you will have, instead of having the MSNA assessment happening immediately, you will have other data sources, probably key informants and data collection, probably direct observation, some other data sources coming. Like if I may get the example of a natural disaster, a typhoon happening in one country, the route of that typhoon, where it hit, maybe satellite imagery analysis, any other data sources that correspond to 3 pillars. So what we're suggesting here is to reorganize the thinking of the shelter needs around these 3 pillars with whatever information available in the country. We're not suggesting that the MSNA or the GF is the unique or the only options that can be applicable to the SSC. That's why we said the fixed part of the SSC is the 3 pillars, where we reorganize our thinking. We have a common thinking all over the shelter cluster, and how we estimate and how we measure and what type of information that contribute to this process for each pillar is up to the country, up to the context, up to the crisis, available information, and so on to help us in doing that. Neil, I saw your hand up. Do you would like to add anything on this?
No, I think you nailed it. So just for Robbie's question, the framework itself would stand. The 3 pillars are important. This is the framework that we are proposing that the sector can use to organize its thinking and to systemize its thinking in a common way. How you get there and how you populate those pillars is an open question and a contextualization question that's up to you. And you're right, sudden onset, informally activated clusters, which I know Robbie is involved in all the time, would depend upon a lot of secondary analysis, secondary data analysis. So that's where we would need to take the framework, and that would be a sort of future development. Sorry, over.
I see there's another hand up. Pepe, do you want to go?
Merci. Est-ce que je peux poser ma question en français? Parce que je me sens beaucoup mieux de vous poser la question en français.
Oui, oui, bien sûr. On fera une traduction après. Allez-y.
OK, d'accord. Alors, j'ai suivi avec attention la projection, mais je voudrais savoir, est-ce que la méthodologie réelle qu'il faut utiliser pour... je n'ai pas vu un peu les détails par rapport à ça, à la méthodologie. Si je suis dans une situation d'urgence, comme je suis ici à Goma avec les déplacés liés au M23 dans un contexte de IDP, quelle est la méthodologie que, selon vous, que je dois utiliser pour déterminer la sévérité d'une zone par rapport à une autre? J'aurais souhaité le savoir parce que, et si ça doit me permettre de prendre une décision, est-ce que j'oriente mes activités ici ou là? Et au niveau du HNO, où est-ce que je dis que les besoins sont plus élevés à ce niveau que par rapport à l'autre? Quels sont les éléments que je dois utiliser pour ressortir cela avec la méthodologie que vous venez de nous dire? Ça, c'est la première question. Deuxièmement, est-ce que c'est la même méthodologie qu'il faut appliquer lorsque nous sommes dans un contexte de déplacement IDP et dans un contexte de déplacement réfugié? Si oui, comment faire? Sinon, qu'est-ce qu'il faut faire pour faire la différence et faire ces calculs-là? Et l'autre chose, la troisième question que je voudrais ajouter, est-ce que ça tient compte aussi d'un déplacement dans un cadre urbain ou dans un cadre rural? Qu'est-ce que est-ce que la méthodologie nous permet de définir la sévérité dans ces cadres? Donc, dites-nous un peu, je voudrais savoir quels sont les éléments qu'il faut utiliser pour ressortir la sévérité qui varie ici entre 3, 4 et 5. Merci.
I'm gonna answer in English, but then if you have any follow-up question, we can discuss. So the overall question was to understand how the SSC is applicable to different contexts, including in this deterioration of an ongoing crisis, for example, or if it's applicable in urban, rural settings, and so on, and how it can help prioritize. So I'll start from the last part on the prioritization. This is the tool as it stands now is to determine needs. It's not to determine targets and prioritizations. So it's really the first step of the HPC process. So the HNO, in the cases where there is an HNO, is to identify the magnitude of needs and the different levels of severity of needs. The next part, which is the prioritization, this is something that the tool doesn't provide yet. In terms of if it's applicable to different situations, absolutely, urban, rural, this is usually something that is taken into account in the design of MSNA and assessments anyway. And to apply it to contexts where there is a deterioration of an ongoing crisis. This is similar to the response that was given with regards to sudden onset disasters. So the idea is that the tool gives you a framework that you can apply, but then the type of data that you use to inform the framework can differ depending on the situation. So for an HNO, you will have more detailed assessments, but then for a sudden crisis, you might have some rapid assessments or satellite imagery and so on. Yep, I see there are a few hands up. Neil, Martha, Frederick, over to you.
The really interesting point here that you raised, Pepe, the opportunity that we have with a tool like this, if you have a common framework like this, and you're measuring things in a systematized way at a point in time, you can use this tool over time to see changes in that severity and the changes in PIN as well. Whether those changes, at one fixed point in time and a future fixed point in time, whether those changes are attributable to humanitarian interventions is maybe not going to be something that this tool can do, but you can use it to measure that change. And I mean, it's a super interesting idea to see how that process can be developed and how this tool can be used as a sequential tool as well, and something that would be done periodically and contribute to changing strategies as necessary. Hope that helps as well.
Maybe now, Camila, if we can proceed, there will be more time for questions as well, but just I don't know if there are more hands up.
Martha, if you want to come in quickly.
No, maybe I will just leave it here. But I was looking at the prioritization. If the outcomes of the severity, we look at area base, and if we have limited resources, we can use the product to prioritize specific areas. If we have less severity in one area in terms of resources, I think we can use it. It can aid us as well. Over.
Yeah, exactly. On the area level, yes, this is what the tool provides. I mean, it gives the indication on which areas are more severe. So resource will be mobilized towards those areas, but it doesn't give a prioritization in terms of household prioritization. So it's not a household targeting tool as of now. So this is just to make this distinction. Yes, it gives the severity per area, per population group, as you go down in the analysis and as you have data sources available, and then you can do your analysis based on that. But it doesn't go to the household level prioritization. Back to you, Kabila, unless there's anything else.
Yeah, Frederick, please come in.
Yeah, so yeah, Camilla, thanks. Mine is more of a, I think I received a question from one of the IMOs during the day. So the issue, what he was trying to confirm is there'll be instances where OCHA will come with their own tool in terms of calculation of the PIN. So what he wanted to know was how are we going to what supersedes the other? Are we going to use the tool? Because I know he was saying that there'll be a lot of push from OCHA in terms of using their own tool or maybe using other methods of calculation. I just wanted you saying to confirm in these instances what supersedes the others. So will the IMOs go with the tool that the OSHA provides or other methodology they provide, or would they go with the SSC? At least I know the answer, but I would like just to insist on that
Sure.
for the others.
Yeah,
Thanks.
sure. Thanks, Frederick, for this. Actually, the SSC goes in line with the whole new system that is done through the HPC cycle. Now, there is no OSHA methodology of PIN calculation. There is nothing called that at the sectoral level. The sector or the cluster does the analysis, generates their own PIN using the SSC, and provides the PIN figure, the severity figures to OSHA. What happens at OSHA level is the GF2 methodology. By the way, tomorrow there's a webinar on GF2 methodology. I will share the link in the chat as well, so you can attend to understand more of how this new GF is different from the previous one, where we got our power again to implement our own methodology, use our own analysis to generate the PIN and the severity figures, then share with OCHA, where all the clusters will be doing the same, and then at OCHA level will be combined together in one defined methodology. So they don't intervene on which indicators we use or which methodology we use. And whenever you have this push from OCHA, please come back to us, and we will be able to sort it out between OCHA headquarters here and the OCHA team in the country. Camila, back to you to continue, please.
Okay, thank you. All right, so now we're going to go into the calculation tools. So how do you calculate severity in PIN? So just to say that we've developed a tool that's intended to facilitate the process for you and automate as much as possible of the calculation. The tool is already available on the website. We'll share the links again. So today what we're going to do is go through each of the steps of the severity and PIN calculation, showing you how to use each of the sheets. But of course, anytime in the coming weeks and months when you're rolling out the SSC, feel free to reach out if you face any issues. Okay, so here, just to show you again, when we're talking about calculating PIN and severity, we're referring to this, the red section of the framework. So the shelter needs and conditions based on the 3 pillars, the shelter itself, the living conditions inside the shelter, and the access to services and the connection with the settlement outside of the shelter. In terms of steps, so first step is and it's what probably most of you are doing right now, is to design the questionnaire. And together with this, and we'll get back to we'll show you details for each of these steps, but just to summarize, so first step, design the questionnaire and fill in what we call the analysis grid. Second step, which comes after data collection, is to format the data set, make sure that it's clean, as you should be receiving a clean data set, but conduct any cleaning and formatting that you need. Third step is to calculate the severity score for each of the 3 pillars for each household using the analysis grid. This is for cases where you have a household level data set. If you don't, you will skip this step here. Step 3B is to calculate the overall severity score for each household using what we call the decision tree. Fourth step is to determine the percentage of households under each severity level for each administrative unit and population group that is relevant to your context. After this, you will determine the severity of each area and or population group using the 20% rule. Just to say that steps 4B and 4A are very similar to what has been done for years with the GF 1, version 1. So some of you may already be familiar with this approach. Step 4C, you calculate the PIN, and the PIN corresponds to the sum of all of the households that have a severity of 3, 4, and 5. And then final step, if needed, you can conduct adjustments, but very important, as long as there is evidence to justify why you're making these adjustments. Designing the questionnaire and filling in the analysis grid. So I'm going to be switching a little bit back and forth between different documents, but yeah, let me actually open the Excel file. Here it is. Okay. So can someone confirm that you're seeing an Excel? Yes, okay, perfect. Okay, so in the tool, you have the README section, which summarizes the instructions on how to do the calculation. Then you have a page that summarizes the SSC pillars, indicators, and sub-indicators that we already presented a few slides ago. Then you have the standard MSNA questionnaire. So what do we mean by standard MSNA questionnaire? This is a questionnaire that we worked on with REACH at global level, where we designed the questions and the responses in a way to ensure that the data needed to inform all of the sub-indicators is collected. However, this is flexible and absolutely adaptable in country. You're welcome to use it as such if it makes sense to you and you don't want to or need to add anything. But you can, of course, modify the responses to align to your context. For example, on the question 1, very standard, what is your type of shelter? Here we put some very standard generic type of responses, but you may have cases where you want to give more details. Same for question 2, where we ask about the damage or noticeable issues of the shelter. Here we put some generic usual ones that are aligned to sphere standards, but you may want to add some that are specific to your context, which may be related to weather or anything that you think is important. So the idea really is that you design the MSNA questionnaire as you wish, as long as you are informing the sub-indicators, which means that in general, all of the questions that are here should be included, but you can adapt the responses or rephrase a little bit the way in which the questions are asked. Okay, next thing is important to, so the next step is once you've done your questionnaire, and this is a process that we recommend that you start as soon as possible before the end of data collection, is to fill in what we call the analysis grid. So how does it work? In the grids, you have in the first few columns here, you have again the SSC pillars, indicators, sub-indicators, and the different levels to measure the sub-indicators that are core to the model. So the idea is that for each sub-indicator, you will get a score. So for example, sub-indicator 1 is the level of safety and security provided by the shelter. So we have 3 levels for this. The first one is that the shelter is safe. The second one is that it's unsafe and can affect goods, property, or mental and physical health. And the third level is that it's unsafe or life-threatening. Depending on the score that you on the responses at household level, you will get a different score. If the shelter is safe, so for example, if they live in a finished house that has no damage and no issues, then you get a score of 0. If it's sort of unsafe, there are some risks, you get a score of 1. If it's unsafe, life-threatening, meaning they have no shelter or it's completely destroyed, you automatically get a score of 5, which means that you're in catastrophic need of shelter. So this is the logic that we are approaching, is that you think about these different sub-indicators in terms of applying a score to the household living in them. So to go quickly over them, there is the level of safety, the level of privacy, the level of thermal comfort, level of security of tenure, and then for pillar 2 living conditions, you have ability to cook, ability to store food and water, ability to sleep, perform personal hygiene, and the level of access to electricity. And then for the last one, you have the level of access to appropriate common service and infrastructure. So that's the logic for the analysis grid. So the exercise you have to conduct is to take the questionnaire, the MSNA or any other questionnaire you're using, and to map the responses based on these 3 levels for each sub-indicator. So if we take the first example here again, which is I think the most straightforward one, what would qualify the shelter as being safe? It would be if the type of shelter is considered a safe type of shelter, and if there are no damage or noticeable issues, and perhaps in this case, there is some damage to floors, but we don't consider that it affects the safety of the shelter. So this is how you would map the responses to qualify as how to measure each criteria. In the second one, this is the type of, for example, the household is living in a tent, but there's only minor issues. So it's not completely unsafe, but still it's a bit unsafe. So you score 1. And in case here, it's completely destroyed or there is major damage to roof with risk of collapse, you score 5. And so on and so forth. Same with privacy. You would map, if the household says there is no privacy in the shelter, then you would score 0.5. Same approach based on the overcrowding. So I can give you more examples, but I also don't want to spend too much time on this. If you have any question, reach out at any time. But the idea is really to bring the coordination team, and this involves not just the IM, but also coordinators, to come together and think through, okay, in our context, what does it mean for a shelter to be safe, unsafe, or unsafe and life-threatening? What does it mean to have privacy, no privacy, overcrowding? What does it mean for the shelter to be adapted to local climates, to not really be adapted to local climates, and not be at all adapted to local climates? So that's really the approach. Try to think through and map the different responses of the questionnaire in the grids. Okay, so that's on the analysis grid. I will.
Camila, before we move on, please, yeah, just to add a couple of comments here. First of all, the scores that you see in this Excel are adaptable. You can assign the scores that you want, but make sure that you finally have the full scale of scores, like of each pillar from 1 to 5 when you redesign the scores. This is the first comment. The second one, on the third pillar, you might have noticed that we don't have questions in our standard MSNA questionnaire on the third pillar, which is the access to services. But as according to MSNA structure, other clusters will be asking about their own services, like and there are the overarching questions in the MSNA about the accessibility of the other services and so on. So this will be covered by other type of questions coming from other clusters. It's not from the standard questions of the shelter cluster. Over.
Okay, so that's the first step, is to have your questionnaire and then to map out how you consider that the different responses will allow you to measure the different indicators of the SSC. Then you collect your data, you format the data set. First step, once you have the data, so conducting the analysis on the data set, is to calculate a severity score for each pillar for each household. So I will just show you the output, but then we'll go back because it's here. So again, here we have dummy data that was developed based on the standard MSNA questionnaire. For each household, you will be calculating an overall household severity score. And we do this by bringing together the analysis grids and the data sets. Hussein, do you want to explain a little bit on how the connection between the data sets was?
Let me just come in. See. Maybe you can mute yourself, Camila, please. Okay. So here we have the, can you hear me, please, just to make sure? Okay, so we have the MSNA data set that we have built it, like we have the random data here, but we mapped all the questions and responses into this table, as you can see, up until the end. And this structure is extracted from the COBO form that we have built for this standard MSNA questionnaire, and is mapped to all our households by population group and different admin levels. Now, what you see here is just the MSNA data in the household datasets sheet. There's nothing else. I mean, it should be coming completely from your questionnaire and nothing coming from outside. How this will be mapped into the analysis grid, like as you see here, we have for each response, we have how it mapped to generate a score. This will be seen in the severity, household level severity to be calculated at each level. Yeah, back to you, Camila. Region 3?
Yeah.
Okay.
Okay, so that step means that you will have, for each household, you will have a score, a severity score for pillar 1, a severity score for pillar 2, a severity score for pillar 3. What we want is to get an overall severity score that aggregates these 3 pillar scores. There was a lot of discussion. How do we do this? Do we do an average? Do we do a weighted average? Do we take the maximum? Lots of discussion. And in the end, what we thought would make the most sense and be more aligned, the most aligned to our overall 5 severity phases, is to have a decision tree approach, which means that the final score depends on first the score of pillar 1, then the score of pillar 2, and then the score of pillar 3, or this is adaptable. I'll go back to that. So as you can see in this example here, if a household has a score of 5 in pillar 1, which means they have no shelter or a completely destroyed shelter, no matter what score they get in terms of living conditions and access to services, they will always be in catastrophic need of shelter. This can be also in cases, for example, where, I don't know, a household is living in a completely destroyed shelter, but they have access to NFI distributions and they have access to services around them, but they're still living in a destroyed shelter. So the severity of that household's shelter needs is 5. That's the logic that we think that we're applying for the aggregation of the 3 scores. However, again, this is adaptable in country. So what we have here is a suggestion, and you're welcome to use it as such. But if you think that in some cases you want to give more weight to one weight, I think someone is unmuted. Yeah, thanks. If you, if you would like to give more weight to one, change the logic of the decision tree, you can do that. You can modify, you can decide here, for example, that if there is a 3 in pillar 1 and a 2 in pillar 3 and a 4 in pillar here, but you decide, okay, pillar 2 is more important, so you can get a 4. Keeping in, yeah, Hussein, you want to jump in?
Just one comment here. In the logic behind the decision tree as it stands now, it corresponds to the definitions that we have in the severity phases. As you've seen in the slide, in the beginning, we have severity phase 1, 2, 3, 4, 5. And for each one, we have a corresponding definition at household level. So we really need to make sure that this logic is applied. Whenever you change these scores according to your context, if needed, we don't see a high need for this change because they correspond to the definitions, unless you really would like to change the definitions, which we don't really recommend for this, but it should be so you should have solid justification behind the change of the definition. But this has really need to be discussed with us before we do any changes in the definitions, and then to any change in the decision tree as such. So this is important to be in line or in coordination with us to make sure that we are still under the same concept or same common understanding on how we measure the 3 pillars. Back to you, Camila.
Thank you. We'll just go through the whole demonstration, and then there's only a couple of points left, and then we'll take the questions, if that's okay. Okay, so once you've done the aggregation of the 3 scores, which is actually done automatically here, this will be calculated automatically for you. So here you'll have your data set, and for each household, you will have a severity score. This will automatically generate here, and again, I will emphasize on that, this is done automatically, you won't need to do it. You will get, for each administrative level and population group, you will get the percentage of households under each severity phase. So if you've done, all you'll need to do is fill in this, but then this part is done, generated automatically. From here, you will obtain first your PIN, which corresponds to the sum of the proportion of households in severities 3, 4, and 5 on the overall population, and the severity score of the area, which is estimated based on the 20% rule, which is 20% rule corresponds to the highest severity phase. So you start from the left and you add 5, 4, 3, 2, 1, and you stop when you get to 20. So in the case of the first line, the 20 is reached when you're in severity 2, so the area is in severity 2. Here as well, here you get it, to give you another example, you get it when you reach severity 3. This is also, these two parts here are calculated automatically. All you'll have to do is to input the baseline population here, and then you will get all of this information calculated automatically.
Yeah, thanks, Camila. If you go back to the previous slide, household level severity. Yeah, here I just want to add one thing. If you see on the under pillar 1, you see all the corresponding criteria with the scores that have been assigned to each criteria, and then we use one formula that will map what we have in the analysis grid to the overall responses from the household data set to generate the score under each criteria, the criteria level. And the sum of all the criteria under each pillar will correspond to the pillar score, and based on the decision tree, the automatic calculation of the overall household level severity happens. It's important here to notice that the first part with the location, population, etc., to be completely corresponding to what you have in the household level data set. And similarly, when you go back to the area level severity and PIN, you will have the same P codes, etc. Here, it's just more or less a little bit of technical manipulation of the Excel when you work as an AMO on the Excel sheet to make sure that your data sounds, your data is clean and corresponds at each data sheet here. We didn't put formulas for each data sheet to copy paste the admin levels and the population figure, etc. They can be done like that, but the Excel template will become too heavy to be able to handle too many formulas. That's why we prefer to do the copy paste for this static part of the admin location and population figures. Back to you, Camila.
Thank you. Let me move back to the presentation. I think we're basically done. So we've skipped a few slides. This was just to show you each step, the sort of results that you will get. But so yeah, in the end, what you will get is what you need for the HNO, but this goes beyond HNO, is the area level severity and the people in need. We'll discuss this a bit more next week, also so we can get a bit of time in case there are any questions, but there is, of course, opportunity to adjust PIN and severity, but this can't be done just arbitrarily. You have to use evidence. We'll discuss this more next week. Okay. All right, so we're done with the presentation for today. Just a reminder, next week, so we'll discuss the next part of the analysis, the outputs, shelter needs overview, how to use it, and how it links to the GF and HNO process. Over to, you want to add something?
Yeah, just to add here on the last part on the adjustment, how we will use the evidence list and based on which rules we can adjust the severity score or the PIN figure and how they will be calculated. This is so important to notice that if we do any manual adjustment or expert judgment or whatever is to be logged, recorded based on what, to be able to defend the cluster position while we are doing these manual adjustments. More details will come next week on how we use the evidence sheet evidence list sheet, and how we will use the analysis that can be generated out of the last sheet, the area level severity plus PIN. We have built an interactive dashboard for that, that if you follow the same process and you come out to the last sheet with the area level severity and PIN, you will have a template for a Power BI dashboard that is already populated with all the analysis that you need, with the flagging systems that will tell you where areas you need to pay attention to the analysis. There might be some mistakes in the data, or data is not so reliable, or maybe there are some outliers that you really need to investigate and check why they are happening. So all of these things we can see next week in an interactive way on an online dashboard, or plus on how to use that analysis in the workshop that you will conduct with your partners, and afterwards how you will draft your shelter needs overview, and that will correspond to multiple objectives. One of them primarily is the HNO, but not limited to that. It will be used for donor briefings. It will be used. It will have some key messages to use for advocacy. It can be used for as a basis for shelter response monitoring afterwards, and so on. So multiple use of this will happen. Maybe we'll see how we can use it in the session next week. So we look forward to have you next week as well. I'll stop here. Maybe we start to take questions.
Noor and then Renee.
Thank you, Camelia and Hussein. I have two questions basically. First one is, that we are also talking about this the centrality of the protection, and that there is we know that under this severity criteria, there is also some special group of people. How can we actually bring them in, especially for this, if there is a disabled person, if there is some other protection related criteria, and also exclusion when we are doing this analysis, because what I understood in this, the criteria is most likely the in general, but in general severity, there is also the other group of people who need some special types of like, because we are sometimes criticized that, okay, in our this MSN or in our cluster, we are missing this kind of the disability or the exclusion group of people information. So that is one question. Another one is related, that for this year under the MSNA, we are going to, there is a sample size is around 13,000 household. So if we are going to analyzing each household, that it means we have to analyze this 13,000 household. So the question is regarding that how we'll also do the capacity of the IMs, actually how they can also do the each household level this severity analysis. And I think that is also another other thing is, that I think as also one of our colleagues previously already mentioned, there is also a lot of push from the OCHA level. They also try to, they have their own severity and they try to put, I think, I don't know, but in for the Somalia that they have this, we face also that they have a severity calculation, and they always try to push from their side to adapt those kind of things. But sometimes it is not always coming without the cluster severity. So I think it is better also if we can also start the communication and advocacy with also the OCHA and other our cluster partner, that it can also help. So, but my main two questions is the before. Yeah, over to you.
Thanks, Noor. To start on the centrality of protection and how we can include underlying vulnerabilities, as you see on the slide, we do consider the vulnerabilities, but if you look at what constitutes the shelter needs are under the 3 pillars. So regardless, the population are like poor or rich, they are disabled, I mean, they have disabilities or not, it's a female or woman-headed household or not. I mean, the situation of the shelter in general, if the shelter is safe, if is the shelter livable, and if the shelter is communicable to outside. This is what constitutes the shelter need. Now, and this is what frames our response as shelter cluster. This is where we can respond. We don't respond to people with disabilities to eliminate their disabilities, but we might target them or prioritize them in our response. And here it comes when you use this analysis of the shelter needs and you add the layer of the household targeting based on the underlying vulnerabilities. And that's why the blue part of this framework is so important to know where you have more vulnerabilities at the household level, or maybe more vulnerabilities at the community level, and so on, more capacities or less capacities, and so on. So this is really crucial to have to conduct the analysis at the beginning of and throughout your implementation of the SSC to make sure that you have that understanding, and then afterwards you can target. When it comes to the household targeting, as we said in the beginning, we don't have this layer yet in the SSC. It can be an addition on the top of SSC to be able to implement it. For now, it's not included as such. This is on the first question. On the second question, when you have 13,000 or 10,000 or maybe 100,000, what you need to do actually, it's, I mean, you don't do a household by household analysis. You generate the formulas for one household. If you can go back, Camila, to the Excel, please. So we generate only formulas for one household, and the same if you go back to the household level severity. So here we have a 10,000 rows in this data set, and we generated for each one formula for each column. So it depends on the responses that you have. It depends on how complex your MSNA is, and you will populate that, and then the whole analysis will be conducted automatically, and it will be summarized at the area level as well. It's not only at the household level. So you don't do household by household analysis. What you need to pay attention to is the area level analysis, where you need to make sure that you don't have any outliers, you don't have any issues with the data. Maybe there are some areas that need special attention when you have high level severity, and most of the population, like you have in severity 5, and all population are living in maybe severity 5. Like, and the PIN in that region is as well too high compared to the total population. So this is a kind of an area that really needs special attention, maybe some advanced analysis why this is happening in that area, and how to mobilize and prioritize that area in your response afterwards. For the third question on OCHA level, again, as I said, I mean, I know this issue happening in the previous year, for instance, with GF 1.1, when we had similar or the common methodology for all the clusters, and we were sharing indicators with OCHA and start doing the calculation based on that. Now with GF 2.0, OCHA has nothing to do with the small box under the sectoral needs, which is the shelter needs here. Has nothing to do with that. It is up to you as a cluster and the cluster team, coordinator, IMO, with your partners to do this analysis and provide the output to OCHA. OCHA will push back in cases like if you are saying the severity of shelter needs in this area is 5, while all other clusters saying it's 1, for instance. So they will just come back to you saying why it's 5 and why it's happening like that for shelter cluster and not for others. Usually sectoral needs goes together in general. So why you are kind of an outlier vis-a-vis other clusters? And if you have a strong justification behind your output, you just say, this is my justification and this is what's happening for us and this is how we understand it. And you provide the output and they have to accept it. If you face any issues with that, please come back to us. We will be in contact with OCHA team at global level and at the country level with you to resolve such issues. But don't allow them to get into your own methodology unless you consult us. I think Renee. Please come forward, Renee.
Yes, good afternoon, dear colleagues. And I have to apologize. I did not receive an invitation to this meeting. So actually, I had gone on with my day, and it was only when I returned that some colleagues had reached out to me to inform me that this meeting took place. So I'm very sorry that I missed the meeting, and I hope in subsequent meetings I can be included on the mailing list. I think some of my team is present, which is nice to see, but I myself, I was completely unaware. So hopefully we can rectify that in the future. I just wanted to provide some feedback from an analysis. As you know or don't know, the Northwest, Southwest Cameroon, we've established our own vulnerability analysis system. I think in terms of the current approach proposed, I was holding back from sharing a lot of the data because we're working on getting the sample size at the lower geographical level required by the H&O process. I think there's some positives of the tool, one being the weight on shelter versus NFI and access to services. I think that's one positive element. I think if you've gone more in detail as we have for some of the other indicators, it becomes a bit more complicated. The idea of maxing out at 5, when you reach shelter severity, it might overestimate maybe the people in a stronger severity because the totality of the shelter needs are not considered. So if you're already in shelter severity 5 for the type of shelter or damaged shelter, then the tenure security doesn't weigh in to the overall shelter situation, which may have you missing out on some other needs. So I think that might be some area for improvement. Equally on access to basic services, which is the settlement planning side, if you have more indicators than just one, for example, if your survey only has access to markets, then the current methodology would be okay. But if your methodology also includes WASH, health, education access, protection access to services, then you're more limited on the results that you might get. So certainly that's some things that I've observed on the methodology so far. Also equally that you might say that, sleeping indicator, you might only include an NFI. But then the totality of the shelter need, some of those weights are not considered in the overall understanding. Because I missed the presentation today, I have not yet seen what was discussed, but I think those are some conceptual issues. I think the challenge is also the need to go line by line into changing the methodology, and the risk of subjectivity and application, especially if you're dealing with decentralized responses, where here in Cameroon we're responding to the civil war that's in the Anglophone regions. My other colleagues are responding to like Boko Haram crisis. Then the risk for subjectivity that both of us might do opposite things when assigning a score is quite high. Because it's your interpretation of the data. So in Cameroon, in Northwest, Southwest, our system proposes a unique score based off of the exact type of response, and then it's a Jenks scale ranking, which is the plethora of needs. I mean, when I was doing the process of comparing the methodology, I saw the beauty of simplification in the global shelter clusters approach. So I was almost hoping your approach would work over mine in a way, because there's some simplification there. But then at the same time, there is also the need to understand the complete context. And then our methodology is also informing beneficiary selection. So I also do see the validity of some of what we've done in the Northwest, Southwest. Yeah, and I think a needed direction to go is, there's the exact definition of things to avoid this subjectivity, and also a bit of a more of a calculation tool in the approach. But happy to go more into detail, especially over the next couple of weeks, and sharing that analysis with with you. I think I still have to follow up with a few partners to get their sample into the coordinated assessment that we're doing. But certainly these are some things that I've already noticed in the approach already that you might want to be aware of. And hopefully we can continue to collaborate together in the future, and happy to join subsequent meetings as I am invited. Thank you.
Thank you, Renee. First, apologize you were not included in the mailing list. We will rectify this issue as of now, immediately. Then, second, just to respond a little bit on how one pillar or one indicator can, overweight over the others and so on. This is just actually brings me to a quick reminder for our session next week, where you will have the analysis, the dashboard analysis. On the dashboard, you will see that you are able to see why you are getting a 5 and based on what. Is it because of the shelter destroyed and it's overweighting everything? And you will see in a kind of a small radar or spider web chart which one is really overlaying and how this final severity score was generated. So this is important to notice for our next session, and we will see how it will be read. Regarding, which indicator is overcoming, and if we are using one indicator and their access to services or not, this is again up to the availability of data at the country level and which indicator are used to be considered relevant to the shelter response or to the shelter need. As well, as I said, we will have this analysis at the pillar level, which pillar is driving the severity. We will have the analysis at the pillar level, each pillar, which indicator is driving the severity of that pillar. So we will see all of these things in the session next week. And I'm glad that you shared a little bit of your experience and your methodology that you used in Cameroon, and we'll be glad to be briefed more on the details to see how we can include them in our upcoming development of the SSC, where relevant and makes sense for both of us. Thank you. Laskuni.
Yes, thank you, Hussein. Yes, I just want to come back to some questions. Perhaps, so sorry if I miss out some element of the presentation. So first, quickly, I just want to ask to think about some alternatives if there is no GIAF or MSNA in the country, because I think the ECC has to be one of the tools that you use, even if there are no GIAF or MSNA at country level. So yes. Another thing which I want to revert about the severity calculation, I see that you gave more weight to shelters instead of NFI. So thank you, because you mentioned that it depends on the country, it's flexible, but I think it is also important to consider that the scenario, if there is no shelter and no NFIs, what could be the response, or yes, relate to these severity calculations? Because when I see when there is no shelters, but there is NFIs, the response is still high. So I don't know why. So I think it's better to think about it. So the last one is about the pillar. I think talk about the shelters, outer shelters, and inside shelter. And I think I want to suggest, I don't know if you already addressed it, but I want to suggest to include also some environmental considerations, because we are committed to centralize environment in our action. So I think it's important in these tools to show or to include one indicators that talk about also environment. So thank you. I think I was clear. Thank you.
Sure. Thank you, Laskuni. First, let me apologize because we are running over time, but we are happy to continue as long as colleagues would like to continue. We have no issues with that. We are glad that this discussion is rich and fruitful for everyone. To respond to your questions, Lasconi, replacement of SSC when we don't have GF, when we don't have MSNA data, and so on, and how we implement SSC. It's a simple answer, actually, for me. How would you do as a coordinator if you don't have GF and MSNA data? I mean, from my previous experience in country clusters, if we don't have household level data, the second level of data that we use is the key informant. We use key informant data. If we don't have key informant data, we use direct observation by our operational partners who are working on the ground. So what they see on the ground. If we don't have that presence, we use any other secondary data analysis. So this sequence of analysis or data sources coming from the high granularity up to secondary data sources. Whatever data source you use, the SSC, the essence of the SSC is to be framed or to be implemented around the understanding of the three pillars and how we measure around the three pillars. Regardless, I mean, we have shown, and we presented today how we implement it with MSNA data, but the same template can be used with key informant data at the area level, can be used with direct observation at area level, and can be used with the last sheet with secondary data analysis. And this will be, we'll see it more next week on the secondary data analysis and how we'll use the evidence list to populate the area level severity and based on that calculate the PIN figure. So more or less, the framework accommodates more data sources or more data collection methodologies rather than to be fully dependent on household level data. So let us not get maybe attached to household level data, but this was just an example because we know in most of the countries where HPC cycle is implemented, we will have household level data. If we don't, we have the alternatives that can be the SSC can be implemented with. On your question on the inclusion of environmental aspect, we already have some indicators there, but as well, again, when we look at this, we really need to see the understanding. We go back a minute to this slide. No, sorry, to we look at this framework, how the environment aspect corresponds to the shelter needs. I mean, sustainable shelter, environment friendly, what is the impact of the shelter conditions on the environment, and so on. So all of these things are kind of included. And besides that, I mean, this would be a good evidence to justify a change of the severity of the shelter situation. So if you have an evidence that the shelter approach in one area is so damaging to the environment and is un-environment friendly or environment unfriendly, you maybe use that as a strong justification to change the severity of that area from 3 to 4 or from 3 to 5, saying this is not sustainable and maybe people are living in good shelters now, but it's destroying the environment and maybe in 1 year there will be a catastrophic situation there for both people and environment at the same time. So this type of things we will be see as well how to use evidence to justify. But we still have some indicators on the vulnerabilities at the system level, and the environment issues can be considered at that level, and the impact of the shelter conditions as well, and the type of shelters under the pillar 1, where you see the adaptability to the climate and so on. I hope I answered all of your questions. I don't know if I missed one.
It's about NFI, the inclusion of NFI. So not inclusion, but in terms of several calculations. So I think you gave more weight to shelters.
Yeah.
Instead of,
yeah. Yeah, actually, in responses where you have two different responses, one shelter response or NFI response, or both like separated from each other, you can use pillar 1 and pillar 2 separately. Maybe you can use or join pillar 1 and 3 together and pillar 2 and 3 together based on the decision tree, and generate two different pin figures, one NFI pin and one shelter pin. If your response or it means the situation in your cluster requires. So I can bring one example for that. Actually, it's a Syria example where they really have two clusters, one shelter cluster and NFI cluster somehow. They do that analysis that way, and still we were able last week or the week before to have a common understanding on how they will frame the MSNA questionnaire and put it back to the same analysis grid and so on, and generate in the end both figures. So it's possible using the SSC. Good. I see Marta and then Eva. I can't see the name.
Yes,
Marta,
thank you. Yes, Hussein, can you hear me? Hello?
Yes, we hear you.
Okay, thank you very much. I think this too is helpful, but I just want to build on what Noon raised in terms of the analysis. If in the future, we can consider when we are doing the analysis, especially for the H&O, how can we bring in the AGD analysis as well? So if it is not collected at this level, how can we do that when we are making the analysis for the H&O and subsequently for the HRP? So maybe to think about that, is there a way that we can add, for example, it will not impact what data we are collecting, but we want to know if we have, for example, persons with disability who are more affected or have severity score 5 or 4 at the household level, or older persons or female-headed household or things like that. Over.
Indeed. Yeah. Thank you, Marta, for this. Indeed. I mean, what we have presented as MSNA questionnaire is the shelter section only. But in the MSNA, usually you will have the protection section, you will have the overarching indicators where they have the household size, is it female household, headed household, is how many children, the age, gender breakdown, disabilities profile, and so on. So this type of data usually are collected in the MSNA yet, but we don't influence that part as shelter cluster. And if you are doing a shelter cluster standalone assessment, yes, we encourage to include such questions in your standalone assessment. But if it is done in the MSNA, we encourage you to go and see what other questions are included in other clusters, because you will utilize them in your own analysis. Like, for instance, in our questions or the section of in the MSNA, we don't have the household size. It's not relevant for shelter as such, but it's relevant for all clusters. That's why it goes in under the overarching question in the MSNA. So that part, we really encourage you to go and see with Reach, for instance, if they are implementing the MSNA, to see the overall, the whole MSNA, not only focus on your questions related to shelter, but see if other elements are really collected by other clusters or not, or under the overarching section.
And also to add, so even though at the moment even though we don't include all of this criteria in the calculation of the PIN itself, you can absolutely include it for any additional analysis that you will conduct. For example, for the narrative of the shelters chapter of the HNO. So for example, you could easily, using the MSNA dataset, generate a percentage of households that are female headed and who are in a specific severity of shelter needs. It won't be included in the calculation of the PIN, but you can still generate that descriptive analysis and then use it for other advocacy papers and so on. And when the time of HRP comes, we're of course available to discuss how you can use this to conduct that analysis as well. It's just not part of the model for now.
Eva, please come in.
Yeah, thank you for the presentation. It's very interesting and thankfully very similar to what we have been doing in Sudan in the past. But we had an added element of hazards. So I'm just wondering, how would you integrate anticipated hazards and risks into your calculation methodology, just to allow for a more nuanced result? You know, given the chronic political and economic crisis in Sudan and now an all-out war, which will amplify all the needs, I'm just worried that it will be difficult to prioritize solely on the basis of these indicators. I just fear we will get all fives. So can we add, in addition to the 3 pillars, a couple of more columns, which will then indicate severity at an admin 2 level, to just reflect higher severity in areas identified as conflict hotspots or flood-prone areas, or just localities hosting large numbers of IDPs stretching local resources, whereby we also have localities which tick all of the 3 of these boxes, you know. So will something like that be possible? Thanks.
Thanks a lot for that question, because actually we probably should have specified this before, but that part is included in the indicator 1.1 here. So depending on how you're getting that, actually, sorry, let me open the Excel file here. So the way indicator 1.1 level of safety and security provided by the shelter is framed is that you have these 3 levels of safety: safe, unsafe, life-threatening. What you can decide to do is, for example, if you have a particular district, I say district, but it can be a much lower admin level, where you know that it's particularly prone to floods or hazards and so on, you can include that as part of your analysis grid. So in that specific area, all of the households living there would be considered living in an unsafe or life-threatening, depending on the criteria level. So the way would suggest to do it is not to add this pillar, but to embed this pillar about the location of the shelter. Where is it? Here. The location of the shelter as part of this indicator 1.1, which means that if the household is living in a location that is considered unsafe, whatever the situation of the shelter in that specific moment, then they would still score a 1 or a 5. That makes sense.
That's perfect.
Yeah.
Thank
Yeah.
you.
Just to add on that, actually, to what Camila has said, more or less here we are looking at the shelter needs. So if I look at the conflict zones, if I'm looking at flood prone and etc., how does those things, how does those external factors impact the shelter needs? This is what we are trying to standardize. I mean, because every country, every cluster will have different, hazards, different locations, different contexts that we cannot standardize that. We can't standardize is how they impact the shelter needs and how impact the shelter that we will frame our response afterwards towards. Because I mean, if you have a high conflict zone, for instance, the impact on the shelter is just still the same. It's the damage to the shelter caused by a flood or caused by maybe another type of crisis. This is what we really need to measure here. While our response is to respond to that need, we really need to keep focus on that rather than to focus on how we mitigate those hazards. So because we cannot stop a conflict, We cannot stop the flood from happening, and we cannot stop the earthquake from happening. And we keep in mind that those things are happening, but how they affect our how affect the shelter needs in the end, rather than what is there outside the shelter needs. This is one thing. The other comment here, actually, it's important to notice that this analysis happens on the reality, what's happening today, or what happened in the last month or 3 months. We can include the seasonality factor in the flood-prone areas when we have locations, tropical location with typhoons, expected typhoons or monsoon seasons, etc. But not to include risk-based needs. What do I mean by risk-based needs? So kind of future projection of the needs. So we don't anticipate that, well, according to the current political atmosphere in this country, a conflict might happen in the next 3 months, and this will affect the shelter situation, and then we include the people in our analysis as people in need. This is not what we do. We don't do, a risk-based analysis. We do reality-based analysis here, including the seasonality that we know it's happening year after year. I wanted to make this comment to make sure that we are all on the same page with this.
Thanks, Hussein. But I'm just wondering, since when we do the PIN calculations, we get the projections as the baseline data. So if we have the projections, which are based on certain trends, why can't we then factor in anticipated risks? Because in Sudan, we are seeing very clearly certain trends, at the moment, so we can anticipate with a lot of certainty some risks. So I'm just wondering, yeah.
This is what I meant by seasonality. Like we know, like for sure, for instance, a monsoon season will happen every year in Bangladesh, because we was worked in Bangladesh. So just to bring that example, the monsoon season happens every year, and unfortunately, the MSNA happens during the time of the monsoon, like when no monsoon is there. So when we know monsoon will happen like after 3 months, and the shelter situation will be deteriorated. So we really need to consider that in our analysis, and this is what I meant by we use the seasonality factor, but we don't use the projection factor. Like if the trends that you are mentioning that in Sudan are really confirmed as trends, then you can use them, and this is some part of your current analysis because they are a reality, but it's yet happening maybe next month. But you are sure that they are coming forward. But it's not that anticipated as a risk-based analysis, like what if this risk happened and then how we will respond to it.
Okay, clear. Perfect. Thank you.
Thank you. Adio?
Yeah, thank you very much. I hope you can hear me.
Yes, we do.
Yeah, sorry, maybe I missed the first webinar on the tool, and so I'm sorry if I'm asking questions that have been I would say answered already. But I have a few points. The first one is related to the household level data. Here I'm sure that we have, because we conduct an MSNA, and but we don't receive that household level data. So I just want to because what we receive is basically population group data at admin level, and that it's already aggregated. So to make sure that we get the best of the two, do we have to request, because we might be the only maybe cluster to request that, do we have to request household level data to conduct the analysis? That's the first question. And the second one is mostly related to the tool and the analysis guide. Like my question is, here when we calculate the PIN, of course it's an overall figures, but we are, let's say, asked by OCHA to provide a PIN at activity level and by population group as well. So do we have to kind of customize the analysis gate, like the tool, to make sure that we are able to incorporate this element? For example, for seasonal activity like winterization, do we have to put specific indicators? So because I can see that we have the shelter and the NFI, but then I struggle a little bit to find out how we can make sure that these indicators are really well captured in it. I'm not saying that it's not there because this one is completely new to me. So I have a lot of questions that I'm not going to raise here. I will go through the tool as well, discuss it when I see you in Geneva, for example. But just to make sure that the tool can also, it's able to accommodate this need. Actually, at the end of the day, when we are asked to provide the PIN at a very detailed level, not only the overall figures for the PIN for shelter, for example, but for a specific activity, for a specific population group. And then the third one is, I mean, I think you raised it already, but it's more like a suggestion. It's good to have those kind of systematized approach when it comes to calculate, to do this, I'd say frequent work that is done every time on annual basis. But is there any plan to get something similar for the HRP? This is very important. Why I'm asking that, because sometimes we have the needs and then we have the HRP, we have the target, and then we have a difference in terms of percentage, and we get sometimes question for evaluation team or from OCHA when they compare the different, I'd say, proportion of population that are targeted compared to the PIN. So it's good to have like a kind of also standardized approach for that. So do you have any plan or any kind of guidance that are ready, or any plan of developing something like similar? Over to you. Thank you very much.
Thanks, Kalyu. First, on the household level data set, well, usually REACH is conducting the MSNA in countries. I mean, but whatever, regardless, whomever is conducting the MSNA and whomever is having the custody of the overall household level data set, it's not that you are the only cluster asking for that. You have the right and to get that data, because the MSNA is conducted on behalf of all clusters. So you have the right to request it, and if there's any pushback on that, please contact us. We have common agreement with OCHA and with REACH on this level. So filter part plus any other indicators that we requested from any other cluster, we have access to them to get our analysis done. This is for sure, we can do it. And you have the full right to do it. And whenever you have the pushback, please come back to us and we will support you to get the data. Second, on the seasonality, on the population group, area level, activity level, like this is the framework. You can implement it at any level that you want. And in the demos that we have seen, it's implemented at admin 2 level and 2 population groups, IDPs and host community. I mean, you can go below if you want to go under activity level, for instance. Like if you can implement it only for winterization process and select the indicators that are relevant to the winterization and so on. But with such custom implementations, you need to make sure that you are selecting the proper indicators and that you are adapting your analysis grid towards what you really would like to get. And you make sure that you are reading the 3 pillars accordingly, because in the winterization process, mostly it's on NFI distribution. So you will look at the pillar 2 severity only, rather than to look at the composition of the 3 pillars to get the severity. And you will calculate the PIN out of the pillar 2 only, rather than to calculate it out of the 3 pillars. I'm just giving a rough example here, but it is up to you to decide which part of the methodology or the framework to be used. But the most important thing is to share or to keep that common understanding on how these needs are measured under this common approach of 3 pillars, indicators and sub-indicators, to keep the spirit of this methodology there, but you can implement it at any level. On the HRP side, targeting and so on, again, as we said, this is the first rollout of the SSC to measure the severity and pain, to conduct the need analysis. Once we finish this first rollout, this tool or this framework is not final in terms of is like a lifespan time, like framework that you will never update or develop. We will continue to develop this methodology or framework based on the lessons learned from the field, from the first implementation. Once we will have this first rollout, we are considering to implement the second layer when it comes to planning, targeting at household level and activity level. This is important to notice that it's not included as of now in the methodology, but it is one of the things that we are really considering for future, because it will allow us, as just to go beyond the planning, it will allow us to monitor the response and to measure. I mean, and this is the key word here, to measure the impact of our response on the needs that we have identified. Because I'm sure you have seen that, I mean, all of you, that every year we kind of start or we kick off the HPC cycle, or we kick off our response from scratch, as if we are responding to a new crisis, like as if nothing has happened. And we have seen in many places that every year we are distributing the tarpaulin and no real impact is happening on the life of the people that we are serving there. So it's crucial to develop those methodologies, like gradually, to be able to measure the real impact that we are creating, or we are bringing to the lives of the people that we are serving in the field. And this is what we ultimately look for. And this is one of the missing parts in the humanitarian system, actually, the impact measurement or the impact analysis of the humanitarian response in any context, not only in the shelter cluster, but overall. And we are trying to push forward to measure that actually in our methodology, but step by step, hopefully we will be able to get there. There any other questions? I was not following the chat. I don't know if there's any questions in the chat. Please, colleagues, if you have posted any questions in the chat, please come in.
There's one question: how would the tool address the issue of the baseline for calculations of PIN in the context of protracted crisis where the date? Yeah, so sorry, Serge, if you're still online, would you like to come in and so we make sure that's your question? If I understand correctly, it goes back also to a previous question about how how we use displacement data that might evolve in terms of the projections for the year after. So the answer to that, wait.
Maybe if I may come in, Camila, here.
Yeah, go ahead.
So baseline figures are coming from OCHA, and they are estimated at the system level, not at the cluster level. So IDP figures, host community figures, all those, overarching figures are coming from OCHA, and they are agreed upon at the country level, like context by context. So we don't need to worry about those baseline, but the baseline is really where we start our analysis from. I mean, whatever the baseline is, we start our analysis from there, and we continue. We don't need to invent any baseline for ourselves, especially on the population figures, because they are system-wide agreed upon figures, and we take it from there. This is important to keep in mind. I hope I mean, because I didn't read the question very clearly, but I hope I answered the question out of Camila has read. Okay, I'm aware that we have been 35 minutes now over the planned time, but it was really a great discussion, great questions, and thank you all for staying with us until this late time, especially colleagues connecting from the Far East. And we will wish a good day ahead for colleagues connecting from the far west. We look forward actually to have all of you in our next session, where we will build up on the current or the today's session and presentation to continue to see how we will use the analysis, how we will organize the analysis workshop, and how we see the outputs of this analysis. The next session will happen on Tuesday, same time. We will try to make it the planned time 1 hour and a half, but if the discussion goes beyond, we will make ourselves available for further discussion as well. Please make sure to go through the guideline on the website, read the documents. If you missed the first launch webinar, the recordings are on the website. Please familiarize yourself with all of these things. And as I said, we look forward to have all of you next Tuesday with us. Thank you so much, and have a good afternoon, good day, and goodbye.
Thank you, everyone.
Thank you.
Thank you. Goodbye.
Thank you and bye-bye.